On behalf of the board of the Philippine Bayanihan Society in Singapore, I welcome you to the Bayanihan Center. The Bayanihan Center has opened its doors to support the educational, social and cultural needs of Filipinos and others in Singapore. Thanks to the strong partnership between the government of the Philippines and Singapore and the initiative of our founding president, Ms. Jenny Chua, and vice president, Mr. 𝗥𝗲𝘀𝗽𝗍𝗪. Since its establishment in 2001, more than 13,500 people have undergone skills training at the Bayanihan Center. But the Bayanihan Center is located at 43 Pasir Panjang Road. It provides classrooms, facilities and support for volunteers and community groups to conduct various short-term courses including basic and advanced computer training, nursing aid, hotel and restaurant management, dressmaking, caregiving, cooking, baking and cosmetology. To foster the socio-cultural ties between Filipinos and Singaporeans, we also organize the Bayanihan Walk. It is an annual event to bring together people from all across sectors of Singapore in a fun walkathon to promote integration of Filipinos with the Singaporean community. Tara na mak, Bayanihan Center na.
Hello, good evening everyone. A marvelous evening to Singapore and a warm welcome to all our viewers from around the world and especially here in Singapore. I am Joanne Paula Caritativo and I will be the host for the first webinar of the year of the Bayanihan series talk. Now, we are going to discuss pet care management and pet care emergency. Let me introduce to you our guest speaker for tonight. Okay. Our guest speaker for tonight is Dr. Andres G. Galvan. He earned his degree in Bachelor of Science in Animal Husbandry and degree in Doctor of Veterinary Medicine at Central Luzon State University at Science City of Muñoz, Nueva Ecija, Philippines. He was also a swine technician at Muñoz, Nueva Ecija Swine Producers Associations Incorporated from March 2004 until April 2006. Moreover, he was a veterinarian at Vetline Veterinary Clinic in Philippines from September to December 2006. In addition to that, he's also a veterinarian at Foster Foods Incorporated from December 2006 to September 2007. He is also a veterinarian or sales executive at Animal World, Dubai, United Arab Emirates from September 19 to 2007 until September 19, 2008. In addition to that, he is also a senior veterinary technician at Mount Pleasant Veterinary Group Singapore from September 23, 2008 to March 6, 2022. At present, he's also a lecturer at Temasek Polytechnic since March 14, 2022. Moreover, dear fellow Filipinos and our viewers from around the world, he's also a very active member of the Filipino community and here in Singapore as well. He's the president of the Veterinario SG, or Filipino Veterinarians in Singapore. In addition to that, he's a member of the Philippine Veterinary Medical Association, or PVMA, and also a member of the Singapore Association of Laboratory Animal Science. He's an associate member as well at Singapore Veterinary Association, and also a secretary at Veterinary Circle for 10 Alumni Association. At present, he's also the president for P4E, or known as Partners for Excellence at HFSE International School. Without any further ado, let us all welcome Dr. Andres G. Galvan to talk about pet care management and pet care emergency. I'll turn over now the microphone to you, Dr. Andy Galvan.
Hello, hi, Miss Joanne. Thank you so much for that very overwhelming introductions. Okay, so let me share my screen first. Okay, can you see my screen, Miss Joanne?
Yes, we can see your screen,
All right,
Dr. Galvan.
Sorry, just hold on now. Okay, some technical issues on my laptop. Okay. Again, good evening, everyone. My name is Andres Galvan, so you can just call me Andy. Okay, I'm currently teaching here in Temasek Polytechnic. Temasek Polytechnic is the only school in Singapore offering this diploma in veterinary technology. Okay, so before we start, I would like to mention this learning outcome. So at the end of the lesson, participants are expected to describe proper handling of dogs and cats. So later, before we end up, we make sure that we are able to describe some of the proper handlings. Okay, familiarize with the techniques in simple procedures in ear, nail, and anal gland management. So if you don't mind, if I speak Tagalog, so we can do Taglish here. So sisimplihan lang po natin, so hindi natin gaanong lalaliman ang ating diskusyon because karamihan po dito ay siguro hindi naman maalam sa mga technical terms regarding veterinary medicine. Okay? And lastly, we will identify some emergency situations and the animal emergency clinics in Singapore that you can bring your pet. Okay, so but before we proceed, may I invite everyone to please open your browser. Okay, paki-on lang po yung mga browser nyo, Google browser, or if you have a second device, okay, go to browser and then type in classpoint.app. Okay, so classpoint.app. Yeah, meron na po tayong tatlong pumasok sa loob. Baka po pwede pang pumasok yung iba. So meron lang po akong konting katanungan regarding just two questions. So I just want to see how many of the people here, kung ilan po sa atin dito ang may alagang hayop, kung may alagang aso, o may alagang pusa, or meron kayong pocket pets. So yung pocket pets po includes our rabbit, hamster, guinea pigs. Okay? So yeah. Okay, so I'll give you 1 minute to join, please. So sa mga naka-online po, pwede rin kayong mag-join. So kung meron kayong second device or to your phone, just type in Google classpoint.app. Okay? Alright, so meron na po tayong 5. Ayan, thank you so much for joining in. And then later po, kung gusto nyong i-catch yung slides na ipipresent natin, so you can easily screenshot or using this ClassPoint app. Okay, so thank you so much. Maraming salamat po sa pag-join. Okay, so maybe 10 is good enough, okay, to represent the participant. Okay, my first question, please help me answer this. Okay, here we go. All right, okay, first question, what pet do you have? Okay, so gusto ko lang pong malaman kung ilan sa atin dito yung merong aso, pusa, or pocket pets. Okay, so mainly we are hoping that most of the participants here are in Singapore. So meaning mas aware tayo kung kailan natin dapat idala yung ating aso, ating dogs and cats to veterinary clinics. Okay, so meron po tayong 2 minutes to answer that. Okay, all right, I got 10 participants answer the question. Okay, so majority po dito sa atin ay mayroong aso. Okay, so and then 3 of us have cats and 1 with pocket pets. Maybe later, maybe you can ask, you can tell me what kind of pocket pets do you have. Okay, all right, thank you. So the reason why I asked this is so we can focus on the specific animals that we have during our discussions later. So I can award you some stars. Yay, thank you. Okay, next question. Okay. May nagpa-pop up kasi sa okay, okay, next questions. How often do you take your pet to the veterinarians for checkups and preventive care? So gaano niyo po kadalas dinadala yung pet nyo sa veterinaryo? Kasi karamihan po sa atin dito, minsan dadalhin lang natin yung aso kapag may sakit. Okay? So they are not aware about the importance of a regular checkup and preventive care. So when we say preventive care, kasama po dito dyan yung vaccinations. Later, Dr. Randy will discuss about vaccination in some diseases. Okay? And then kasama din po yung dental prophylaxis. Okay? And then, and of course, the annual general checkup. Okay, let's see kung ilan sa atin dito. O okay, parang okay, all right, sorry. Okay, so you can answer it again. So how often do you take your pet to the veterinarians for checkups? In Singapore, isa po sa mga masasabi nating kinukumpay ng ibang kliyente. Sabi, napakamahal naman ng pa-check up dito sa Singapore. Okay? So mas mahal pa sa mas mahal pa sa tao. Kasi in reality, bringing your pets to the clinics is not really subsidized by the government. Okay, so I understand that. Okay, and then some of us don't understand that if you don't bring them regularly, pag nagkasakit yung aso nyo, tinamaan ng parvo, for example, mas mahal pa yung babayaran mo. Kahit na i-accumulate mo pa yung yearly vaccinations na binabayad mo pa dahil. Okay? Alright. Once a year, okay? That's good, once a year. Pag may sakit, okay? Yeah, this is acceptable. Yeah. Kagaya na sabi ko nga, medyo mahal magpa-doktor dito sa Singapore. Quarterly, that's very good. Okay? And then if sick, and then every month. Okay, so later, some of this we'll discuss by Doc Randy. Gaano ba kadalas dapat dalhin yung aso natin sa clinic and kailan dapat dalhin for vaccinations? Okay, thank you so much. Okay, so to proceed in our proper discussions for tonight. Okay, for the introductions, we will, as I have mentioned in our learning outcomes, first is we will try to describe some of the techniques in handling dogs and cats. Okay, so first, you need to consider, if you are talking about dogs, you have to consider the life stages. So when you say life stages, ito po yung puppy ba sila, adult dogs, or geriatric dogs. Okay, so when we say handling, we're talking about the physical handling, on how you properly handle them, how you properly carry them, especially for puppies, right? So they are very playful naturally. So very playful pet. Yung puppy stage po, nasa 1 year, okay? So 0 months to 1 year, and then adult from 1 to 7, and then starting 7 years old, we can consider them as geriatric. Okay, later I will explain to you how to handle them properly. Okay. So when you restrain them, of course, you have to consider the size and the breed. So small breeds like Chihuahua or Schnauzer, okay? And then for the large breed, is it a Golden Retriever or German Shepherd? So how do you carry them when they are sick, okay? So it's very important because if you don't know how to carry them, maybe minsan mas magkakaroon pa sila ng problema kung improperly handle them. And of course, animal behavior, so body language. Kailan mo dapat i-approach yung aso? Kailan mo dapat i-approach yung pet? Okay? So hindi ibig sabihin nun na nakatingin sa yung aso, okay sila. Okay? Sometimes ginagawa natin, i-offer natin yung hand natin na ganyan, and then let them sleep, something like that. Okay? So later I will explain that. Okay, next, for cats, how do we handle them properly? First of all, you need to consider their behavior. Okay? Same thing with their body language as in dog. And then comparing it to the dogs, cats, they love their space, okay? Makikita nyo sa Facebook, minsan mas authoritative sila. Ako yung boss, sabihin ng pusa, kumpara dun sa dog, okay? So we have to respect that boundaries, okay? And then cats may scratch or bite if they feel threatened or stimulated. So dapat alam natin kung kailan dapat, makikita natin yung mga signs kung yung cat ba ready to bite or will scratch you anytime, something like that, okay? And then safe handling techniques. So ano yung mga kailangan natin para masabi nating mapapabuti yung pag-handle natin sa pusa. Okay? So we can either use a carrier itself or we can use the e-collar. Okay? And then towel. Towel is the best friend. I think Dr. Randy know about this when we are working in the clinic. Towels is very useful in restraining animals, like especially cats and rabbits. Okay, next slide. Okay, simple technique. We will also discuss about ear cleaning, nail clipping, and anal gland. Why these three? I choose these three topics because it's the most common thing for pet owners, especially for those first-time pet owners. Okay, ear cleaning. So first of all, when you are doing ear cleaning, you need to make sure that you examine the ear. So you need to use all your senses. Okay, so examine your pet's ears for signs of redness. When we say redness, there's some inflammations. Okay, meaning there's some inflammations, and then swelling. Swelling can be because of infections or tumor or something like that. And then discharges. So may mga tulo ika nga. Okay, and then may pus coming out, some discharges, and we need to use our sense of smells. Okay, so we need to check ano ba to, mabaho ba ito, or yeasty smell ba yan, or something like that, and then we will know whether what's the cause of this discharge. Okay, this could indicate an infections or other ear issues. For nail trimming, so trimming your pet's nail is an essential part of their grooming routine to prevent discomfort, injury, and maintain their overall health. Karamihan po sa atin natatakot mag-cut ng nail kasi hindi alam kung hanggang saan. So later I will show you a picture of hanggang kailan na kayo pwede mag-cut. Okay, meron tinatawag na quick na kung saan ito yung mga blood vessels sa nails dapat nating i-prevent, especially if the nails are black in dogs. And again, anal gland expressions. So anal gland, expressing anal glands, also known as anal sac, is a procedure that helps relieve discomfort and prevent potential issues in dogs and occasionally in cats. So mamaya tuturuan natin kayo kung paano ba i-maintain tong anal gland at ano ba tong anal gland na to. Okay? So earlier I mentioned about puppy and small breed. So as you can see here, this is the proper way of handling small breed, including puppies. So if you will notice the left hand of this guy, by the way, all the pictures that I will send to you, I'll show you later, taken from Temasek Polytechnic. Ito po yung ilan sa mga aming estudyante na tinuturuan kung paano mag-handle ng animals. Okay, and then meron din po tayong, yung tinatakil natin dito is actually a 3-day short course in pet care management in TP. So if any one of you interested to learn more about pet care management, and then you can inquire in TP, and then you can enroll for a 3-day pet care management, which I think subsidized by the government. Okay, so when you handle small dogs, make sure that you support the chest and not you are pressing the abdomen. And then additionally, maybe this person, whoever is handling, can use the right hand to support the jaw or the neck area. Okay, so especially if you're doing ear cleaning, then you can assess whether the dog is trying to bite you or go to the other side, something like that. Okay, and then next. Okay, now for a larger breed, this is how we handle them. So kung meron kayong dog na around 20 to 30 kg, obviously it's very difficult to carry them. Okay, so karamihan po kasi sa mga large breed, ang mga nagiging issue niyan, cannot walk. Okay, so if you don't know how to carry them properly, it may injure them, and especially you also. You can also get injured pagka mali yung paghawak mo sa kanila. So sa una po, itong first person handling, okay, again, supporting the chest. Okay, this hand, the left hand of the first person can also support the front leg, and then the right hand arm supporting the head and the neck, and then the second person supporting the hip around the rump area here, and also supporting the hind legs here. Okay, so this is how we handle the large dogs. Carrying cat. Okay, so carrying cat or restraining cat is a little bit controversial. Okay, because as you can see in the first video, in the first photo here, they are scrubbing the cat. Okay, some people say, oh, it's very cruel. Okay, so we don't want to scrub cats. In some clinics, they still practice scrubbing. In some clinics, they don't want to practice this. It depends. Okay, for my opinion, okay, I'm okay to handle them case-to-case basis. Okay. Kung mapapansin niyo po yung nanay, paano ba hawakan ng nanay yung pusa? Diba ini-scrub niya dun sa neck area. So something like this lang din po. And then make sure that you are supporting the hind leg. If you can see here on the right hand, supporting the hip or the hind quarters of the cat. Kung hindi naman po ganong agitated yung cat, at medyo okay naman siya i-handle, then you can use this technique wherein same with the dog when you handle small dogs, but you need to support with a little bit of scrubbing around this area. Okay, and then if you need to restrain cats on the table, okay, this is another way. So supporting the abdomen and the chest area here, and then scrubbing a little bit so that it will not run away. Or you can just press the cat down, giving a little bit of pressures on the table. And the most important one, and I mentioned earlier, na karamihan po madalas gamitin sa clinic, yung tinatawag nating burrito. Okay, so burrito cat. Okay, so it's like wrapping the cat like a baby. Okay, the purpose of this to make sure that the arms or the legs will not scratch you. So there's a proper technique again on how to do this. So in school, we teach our students on how to burrito the cat properly. Kasi kung hindi po proper yung pagkalagay mo ng towel, maaaring mag-cause pa rin ng injury at mapahamak yung kung sino man yung nag-handle. Okay? Yeah, we mentioned about body language in dogs. So these are some of the interesting body language that the dog is really showing you that sometimes we don't know. Okay? Karamihan sa atin, so cute like that. And then nakikita mo na yung aso may tinatawag ding whale eye. So nagpapakita na siya ng sign of aggression. Okay, nagpapakita na siya. Okay, so this means I need space. So don't go near me. If you go near me, I don't know what will happen to you. So I may just bite you straight away like that. And some of us don't know these signs. Okay, and very obvious, this anxious look of this dog. If you can see, the tail is between legs. Okay, so this is very common. So yeah, so we have to be aware of this. And same with human. Tayo po pag na-stress tayo, di ba? Nisisigawan ganyan, di ba? So ganun din sila. So mayroon din silang tinatawag na the shake off. So some of the dogs sometimes they are just showing some kind of stress signals. And when they are relaxed, you can see that they are showing their belly. Okay, and then they're wagging their tails. Okay, wagging tails is another way of checking whether the animal is showing you some signs, especially in cats. Okay, so most of us, pag nakita natin yung pusa na naghihiss, aside from hissing, showing teeth and opening mouth, and very tight mouth, means that it's very distressed and very scared or willing to bite. And then this is the common thing. But I want you to focus on the tail, okay? The cat tail language. If you see the cat tail upright like that, so it can be a sign of being happy, okay? If nakita nyo yung cat na medyo fluffy, yung tinatawag na tail flap up, okay? So it's a sign that may be frightened. I think very obvious sometimes when we see cats, when we approach them, stray cats, and then itatayo yung tails nila na ganyan, and then makikita mo nagpa-flap up, parang natawag doon sa atin yung parang tumataas yung balahibo nila, ganun. Okay? And then another thing is the sign that may be nervous is the tail tucked in. Okay, same with dogs. You can see the tails are in between. And another important thing is when they are, I don't know if you can see here, when the tails are wagging like this, when the tails are wagging, the speed is quite fast in doing this way. Okay, it means that irritated na sila. So they're giving you signs na, okay, huwag kang lumapit sa akin. Okay, kakagating kita, kalmutin kita. Okay, all right, next. Ear cleaning. Okay, so I'm doing the presentations very quick because I think I only have 20 minutes to deliver my slides. Then later, I'm very free to answer all your questions. Okay, another thing is ear cleaning. Ear cleaning is one of the most important things that we encounter in the clinic. And then I think it's good to know what are the normal ear look like. Okay, so as you can see here, the ear is even in color. Okay, medyo pinkish siya, very clear. And then you can see all the ear canals. Okay, and then on the lower left side, then makikita nyo po yung ear dito is medyo discolored. Okay, we don't know whether it's just pigmentations of the skin because this dog looks like an old dog. But the thing that is very obvious is the redness around the skin around here. And then there's some discharges, some crustiness, and some redness. Okay, I have a model here. I don't know if you can see. Okay, so the ear structure. So one of the most common questions that we receive from the client is, I'm so scared if I can put the solution inside. Okay, so normal structure po ng ear ng dog and cats is something like an L shape. Okay, sometimes we are scared to go all the way inside because we are thinking that we will hit the eardrum. So the eardrum is very far. Okay, so the eardrum is here. Yeah. Okay, so it's an L-shaped thing. Okay, and then pag po inflame yung ear ng aso, makikita nyo na walang obvious yung canal, medyo thicken. Okay, I'll show you the next slides. Okay, so this is the example of a normal ear structures of a dog. Okay, I mentioned that's an L-shaped thing. Okay, so you can actually put the solutions all the way inside, and then do the massage, and then make sure you dry it after that. Okay, pagka po ang ear ay infected, makikita nyo wala itong kanal na to. So medyo mahirap siya i-visualize, and then very inflamed, and then a lot of discharge. Okay, all right. If you have questions about ear cleaning, please let me know later. Okay, next, the nail clipping. Nail clipping, ito po makikita nyo, meron isang technique dito. Sa Facebook makikita nyo din na kapag nag-nail clip, and then minsan lalagay sila ng bote para to prevent them from biting you. So this is the quick that I'm mentioning earlier. So the quick is the part of the nails wherein all the blood vessels are lying down here. So you need to cut maybe a little bit, few millimeter, okay, away or before the quick. Ang technique, ang tanong po, paano Andy kapag yung aso ko itim yung kuko? So paano yon? Okay? So pagka itim yung kuko, ang ginagawa ang technique ko po, ika-cut bit by bit. Okay, bit by bit. So and then you have to look out at the center. So the center of the nail sometimes is a bit choky. Okay, so medyo maputi-puti. So ikat mo pa siya left and right, and then on top, cut until you will see a little bit of like a fleshy looking center. So it means na malapit ka na doon. So and then you can stop from there. Okay, yeah. Okay, so next. Anal gland expression. So anal gland expression is an important aspect of maintaining a dog's hygiene and comfort. Okay, so ano po ba itong anal gland na to? So hindi siguro lahat sa atin dito hindi alam kung ano itong anal gland. Actually, yung tao meron din po. Kaya lang hindi natin unknown yung function na to. So kung para madali pong intindihin, if you know the skunk, yung nagpo-project ng mabahong amoy, pag tumaas na yung tail na ganyan, then magbubuga ng mabahong amoy. So yun po yung skunk. Okay? So very prominent kasi yung anal gland niya doon. Okay? And then for dogs and cats, it was located around 4 and 8 o'clock. Okay? 4 and 8 o'clock. And then what's the functions of this? Anal glands, they use it as their way of identity. Okay? Kung mapapansin niyo po, if you bring your dogs outside in the park, then mapapansin nyo, nag-aamuyan sila ng backside. Okay? Bakit nila inaamoy? Okay? So, ina-identify na lang, oh friend, ikaw pala to, something like that. And then, another way of, another use of functions of anal gland is when they are threatened. Okay? When they are scared, usually magre-release sila ng anal secretion. Okay? And then, yeah. So, ang tanong ngayon, regular kasi ang secretion na tong anal gland. So, what is the importance of this? Okay, so if your dog's poop have this normal poop, okay, so usually kapag yung poop niya hard enough, then it will squeeze together with the secretion. Okay, but if your dog is having a loose stool or diarrhea, sometimes nag-accumulate yung secretions. Okay, that's the time wherein your dogs will become a little bit uncomfortable about the backside. So the signs that they are showing is scooting. Okay, they will try to rub their backsides on the floor. And then you are also, hey, why are you doing that? Okay, so may irita ka sa aso mo, bakit niya ginagawa yun? So hindi mo alam, anal gland na pala yun, medyo a little bit irritated na. Okay, kung hindi ka aware about this, then it may cause to burst anal gland sac abscess. Okay, so this will cost you a lot when you bring this to the clinic. Yeah. Okay. So now, so paano natin ngayon i-maintain to, Doc Andy? Okay. So first, there are two techniques on how you can do this. So it's part of dog's grooming, the inner gland, okay, management. So kapag katapos mo or during your showering, okay, when you shower your dog during grooming, usually the groomer, okay, they will squeeze the inner gland. And there are two techniques on how you can do this. Number one, use, okay, if this is the inner gland 4 and 8 o'clock, then you squeeze together both sides of this left and right. Then you squeeze using your thumb and your index finger, squeeze together, and then you will see it like coming out. Okay, I think there's something wrong with my picture here. Yeah, and then that's the first technique. So if it is full, you will feel it like a marble on the 4 o'clock area and the 8 o'clock area on your dog's anus. Okay. And then if there's some difficulty squeezing the inner gland, so I would recommend the next technique, which is putting your finger inside the inner gland and then try to feel the lump around 4 and 8 o'clock. Okay. And then you individually squeeze it. Right. So that's how we should keep it or maintain it properly during grooming. Okay, so if you have any questions again regarding inner gland expression, please let me know later. And then now, I'll do it very quick. Emergency situation. So ano yung mga pagkakataon na dapat dali na agad natin sa doktor yung ating hayop, yung ating alaga, aso man yan, pusa or pocket pets. Okay, number one, vomiting. Okay, so vomiting can cause them dehydration. Okay, but you need to know how many times when you go to the vet, right? So you need to state how many times your dog is having this vomiting, and you need to describe, is it yellowish, indications that, you know, wala nang food doon, puro bile na lang ang lumalabas, or is there any blood in the vomit? Okay, and then diarrhea. Okay, you need to mention about the consistency of the diarrhea. Is it very watery, okay, bloody, smelly? Okay, so for me, if you notice that your dog is having this like 2-3 times a day, I think you have better go and see the vet. And most importantly, if there's any breathing problems. So later I will show you a video on how to assess whether your dog is having these breathing difficulties. And I add in here the restraining to pee. So meaning your dogs or cats is having difficulty in peeing. Like naguskut sa parate, yung pusa mo, especially if you have male cats, then you have the litter tray, then they go to litter tray frequently and then trying to scoot like this, but nothing is coming out. Okay, and then sometimes there's blood. It's I would say these signs of an emergency, because if not right, there's a tendency that the bladder may rupture. So there could be some obstructions. Okay, we call it FLUTD, so a feline lower urinary tract disease, or sometimes you can call it like FUS, a feline urologic syndrome. Then you have to see the vet immediately, whether the bladder, and then they will feel the bladder, whether the bladder is distended or soon to rupture, something like that. Okay, and it's very discomfort for them. And of course, the bleeding, any kind of bleeding that is very profuse bleeding, okay, and continuous bleeding, definitely you need to see the vet. And karamihan po yung bleeding is because of the RTA or road traffic accident. Kapag may nasagasaan, minsan sa atin yung iba, nasagasaan na, ay, nakalakad pa ulit, okay pa yan, okay lang yan, ganun. So hindi natin alam yung reaction ng animals, meron dong mga fractured in some areas, wherein especially cats, they are very good in hiding pain. Okay, so hindi mo alam in the next few days, and then yeah, it will be worse already. And then the HRS is the high rise syndrome. In Singapore, we are living in a HDB, high rise building, and then very common, okay, very common especially in cats. Kahit na may 9 lives pa sila, okay, minsan karamihan dyan, pag nalaglag sa 10th floor, 13th floor, yeah, very emergency. Okay? And then food poisoning. So when you say food poisoning, anong very common, lalo ngayon, Chinese New Year, karamihan po nagbibigay ng bakwa. Okay? Bakwa can cause diarrhea. Okay? And the most common is during a holiday, during Christmas, or even anytime, chocolate. Okay? Sometimes yung dogs magkakaroon ng access dun sa chocolate, and then we know that chocolate is very toxic to the animals, okay, because of the theobromine. Okay, and then yeah, so kapag nagkaroon ng food poisoning, especially chocolates, you need to tell your vet about what time you observe. So anong oras niya kinain yung chocolate, okay? Kasi it's very crucial. If less than 2 hours, then maybe, or 1 hour, maybe we can give some apomorphine to keep them vomit. Okay, so they will try to vomit everything. Okay, so we will help them to bring out, isuka niya lahat ng chocolate na nakain niya within this particular period of time. Kapag medyo matagal na, hindi na pwede, so it's a little bit more emergency, and then need to put some IV fluids and things like that, and then do some tests. Okay, and then rat poison, very common, or maybe cockroaches, poison tablets, like that. So kapag ka po na obserbahan niya yung aso niyo o yung pusa niyo kumain ng gamot, dapat dalhin niyo rin po yung wrapper. Okay, dalhin nyo rin yung wrapper. Kung let's say rat poison yan, pakita nyo sa vet. Kasi dun magbe-base yung doktor kung ano yung dapat na ibigay na antidote. Okay? Yeah, and very common also, ingestions of foreign bodies. Okay? Ingestion of foreign bodies like durian. Very common sa Singapore also yung durian. Very attracted yung mga aso dyan na minsan kakainin yung durian. And then, kasi matigas yung buto niyan, hindi yan madadigest, maaaring mag-cause ng obstruction yan sa sphincter, so between the stomach and the intestine, and then mostly in the small intestine, then hindi yan makakamove, so magkakaroon ng obstruction. So it's a major surgery. Okay, so some of the foreign body ingestion. Okay, doing it quick. Okay, this is the example of the vomiting that I mentioned earlier. And then diarrhea. So diarrhea plus these signs may indicate a serious issue. Kapag napapansin nyo yung diarrhea, may kasamang vomiting, okay, lethargy, abdominal pain, and weight loss. So definitely you have to see the vet immediately on this. And then this is an example of chocolate intoxications. So after giving the apomorphine, so ito po yung ginagawa namin sa clinic. So pasusukahin namin yung aso until maging yellow na lang yung suka niya. Okay, it means na empty na yung stomach. Okay, so you have to be aware of this. Okay, and of course, for the last slides that I have here for the emergency situations is the breathing problem. Okay, please let me know if you can hear the video. Okay, I will play now.
A common emergency we see here with dogs and cats is when they're in respiratory distress. If you think that your dog is in respiratory distress, some things that you can look for at home are if they are breathing irregularly, meaning that they're breathing either really fast or there is a lot of effort you see. Usually in the abdomen area is when you can notice these effortful breaths. Things like a distress, kind of uncomfortable attitude, so they're trying to lie down, they can't get comfortable, standing up, pacing around, that kind of thing. You can also look at the color of their gums. So if you lift up their lip and look at their gums, if they look kind of pale pink or even white, then that is something to be concerned about. If you have a cat in respiratory distress, things to look for at home look like open mouth breathing. So with cats, they normally breathe through their nose. So if they are open mouth breathing, it's usually a sign of stress or having difficulty breathing. So that is a big indicator if they're having troubles there. They can also be very restless, so trying to lie down, walk around, pacing, uncomfortable. Sometimes they'll even vocalize, so if they're meowing, it sounds weird, you don't know why they're meowing, things like that. If you think your cat or dog are in respiratory distress, you should call the emergency hospital right away. Tell them how long you're going to be so that the medical team can be prepared. This is a true emergency, and when your cat or dog are struggling to breathe, you want to bring them to the emergency right away. Things to expect when you bring your dog or cat to the emergency hospital if they're in respiratory distress is the reception will call the medical team right away. So this would be a technician who will come out, assess your dog or cat, ask you a few questions, and then bring them into the treatment room right away. That includes them doing their exam on either your cat or dog, potentially giving them oxygen if they're truly in respiratory distress. The veterinarian will take a look at them, and then they will talk to you, the owner, about any next steps at that point.
Okay, I hope that one is clear. Okay, when we talk about respiratory distress, it's very important to note on the gum color. Kung medyo pale na yan, so it means that there's some disruption in the blood circulations. Okay, so in Singapore, what are emergency clinics that you can visit if you encounter some of the problems like that? Okay, Number one here in my list is the advanced pet care. Okay, the address is 18 Jalan Pariburo. Okay, so yeah, they are open 24 hours. Then you can call them at 65651-788. Okay, and then the next, we have a lot of veterinary clinics in Singapore and even hospital in emergencies that are open 24 hours. And another one in the Serangoon area, the west side emergency. And then we also have the companion animal surgeries at Buntek Road, somewhere in Balestier, this companion animal surgery. And then we also have the BES at Whitley Road, okay, Whitley Road around near the PIE, okay, exit in Stevens Road. So they are offering a 24-hour emergency. But again, when you have these emergency cases, you have to call them first, and then make sure that you mention all these emergency cases or the signs that you are not seeing on your cat or dogs, so they can be prepared once you reach them, especially if you're having this, if your animals having these breeding issues. Okay, and I think that's all for my slides, Miss Joanne. Thank you.
Yes, thank you very much,
Thank
Dr.
you.
Andy Galvan.
Thank you.
I hope everyone enjoyed the presentation with regards to pet care management and pet care emergency. So ano yung dapat nating tandaan? We have to check the ears, of course, the tail, and of course, the anal part of our pet. Either it's a dog, a cat, or even a packet animal. Yeah, we really had learned a lot from Dr. Andy Galvan. But then, our webinar does not end from here, because we still have another interesting topic to discuss, which is the pet health overview, do's and don'ts. Let me introduce to you our next guest speaker for tonight. Our guest speaker for tonight is Dr. Randy M. Galutan. He was hailed from San Mateo, Isabela, and he completed his Doctor of Veterinary Medicine at the School of Veterinary Medicine in Isabela State University 2008. He also gained his Master in Business Administration at AMA or AMA University in the year of 2020, and another Master's, which is the Master of Science in Fisheries at Pangasinan State University in the year 2022. He is also a diplomate specialist of the Philippine College of Canine Practitioners, a fellow founder specialist of the Philippine Society of Veterinary Surgeons. And also, he's an active member of different organizations here in Singapore and also in Philippines. To name a few, he's a member of the American Veterinary Medical Association, Singapore Veterinary Association, and he's also a council member of the Animal Welfare of the Philippine Veterinary Medical Association. He was also the former president of Veterinario SG. In addition to that, he's currently the secretary of Singapore Eagles Club. With regards to his work experience, he was a veterinarian at 𝗥𝗲𝘀𝗽𝗍, Dubai, UAE in year 2008. And he's also had a work experience at Animal Recovery Veterinary Clinic at Serangoon, Singapore. At present, he works at the Gentle Vet, which is located at Tanjong Katong, since year 2022. Once again, without any further ado, let us welcome Dr. Randy M. Galutan. Dr. Randy.
Hello, good evening, Ma'am Joanne. Thank you po sa ating mga viewers. Salamat. I'll share my slide. Yan. Kita na po ba?
Yes, we can see it, Dr. Randy.
Okay, it's about a pet health overview. Earlier, Dr. Andy discussed with regarding the emergencies and other stuff with regarding our pet dito sa Singapore. So, I'll skip dito na kasi na-introduce na ako ni Ma'am Joanne. Yan. So, the most popular types of dog here in Singapore are very different from others. So, some are tiny, like Chihuahua and Yorkshire Terrier. Most of it are HDB approved. And also, meron din mga pets like German Shepherd, Great Dane, and Bulldogs. Yan. So dito sa Singapore, lahat po ng mga aso ay dapat lisensyado ng AVS or yung NParks ngayon. So pwede niyong tanungin sa boss ninyo kung license ba ang yung mga alagang aso. And then dapat sila po ay mayroong microchip. At syempre, meron din silang passport. So medyo mahigpit po dito sa Singapore with regarding sa mga aso. Sa pusa naman, ang alam ko bawal ang pusa sa HDB at saka most of the time lahat din sila ay mayroong microchip. So to have a quick background with regarding the ancestry ng mga aso, sa Pilipinas, meron tayong local dog doon, yung tinatawag nating asong Pinoy or Aspin. Dito naman sa Singapore, meron silang tinatawag na Singapore Special na aso. Ito yung malalaki. So small breed to large breed, HDB approved. Ito yung mga pets na karaniwan na ini-rear ng mga taga-Singapore, mga Singaporean or expats. So, nabanggit na ni Doc Andy kanina with regarding doon sa mga hindi pwede at saka nagkukos ng vomiting and diarrhea sa aso at saka sa pusa. This is a quick look na mga bawal at saka hindi dapat pinapakain sa aso. Of course, hindi pwede sila ng alcohol. Tayo na lang ang uminom ng alcohol. And artificial sweetener, sugar, hindi din sila bawal din sila sa sugar. Avocado, yan, chewing gum, bawal din dito. Mga condiments na ginagamit natin, hindi bawal din po sa kanila, especially sa pusa. Bawang, sibuyas, bawal po yan sa kanila. Bawal din po sa kanila yung mga raw food like raw fish, raw meat. May mga certain products na sinasabi nila na frozen siya. Yan. Madami mga foods na bawal sa mga pets natin sa aso at pusa. So we better check with our employer kung yung treats or yung pinapakain sa kanila ay pwede ba or hindi. Kasi mas kilala nila or kilala natin yung mga pets natin. For example, bigay ka ng treats tapos nagtae yung aso, problema yon. And then, at same point, we need to know kung ano yung diet nila na pwedeng kainin talaga kasi very prone ang mga Singapore dogs sa allergy. Mas madami kaming cases with regarding sa mga allergic reaction na papakain sa pusa. Even yung mga ginagamit sa panlinis sa bahay, may mga pets na allergic sila doon. Kaya kailangan natin malaman kung ano yung mga bawal sa kanila. And of course, to overview yung mga common puppy diseases na nabanggit na yung mga iba ni Doc Andy kanina, yung nakita lang natin na may sakit siya, matamlay, i-report na natin agad yan. The most the most contagious disease na na-encounter natin dito sa Singapore, parvo, ito yung nagtatay ng dugo, distemper, kennel cough, vomiting, and specifically kapag may nakain lang or nainom yan ng madumi, nagda-diarrhea na. And of course, yung mga flea and ticks. Yan. Punta tayo sa vaccination. As we know, vaccination is very important. Lalo na yung mga may mga anak na dito. Mga baby natin, meron tinatawag na baby vaccines. So kailangan nilang makumpleto. Nire-recommend sa atin doon sa Pilipinas. Sa tao to muna, sa ating mga health centers na dapat kumpletohin ang bakuna ng bata. Sa aso naman at saka sa pusa, it's the same. So why vaccination is important? Number one is for protection. So i-discuss natin later on yung mga klase ng bakuna na binibigay sa aso. Meron tayong mga 5-in-1 and everything. And then number one is for protection in the disease. We correlate ito sa COVID vaccine natin na nakuha from the government of Singapore na nagbibigay sila ng free COVID vaccine. Sa pets naman, bawal na bawal ang bumili ng puppy, ang owner, ng 3 months old and below. Dapat 3 months and above because most of it may bakuna na siya, nag-start na siya ng bakuna. And of course, kailangan laging updated ang vaccine. Requirement kasi ito. Requirement ng NParks or example, ang ating employer ay foreigner o expat. it is requirement kapag dinala na nila yung pet nila sa ibang bansa or bumalik na sila sa homeland nila, requirement ang bakuna sa import at saka export. And of course, kapag sila nagbakasyon or yung boss natin is local, gusto nilang mag-vacation, yung pet, ilalagay nila sa hotel or chalet or pet hotel, requirement doon sa chalet na meron silang passport which indicated doon na sila ay updated sa bakuna. This is a requirement for them. So ito yung mga vaccines na bakuna na binibigay sa mga alaga natin sa puppy, annually, yearly, booster. Yan. Meron tayong tinatawag na 𝗥𝗲𝗀𝗃𝗃𝗃 or ito yung distemper virus. Ito yung neurological sign kapag ito na i-report na ang isang shop or ang isang kennel or house na merong case ng distemper, i-shutdown yan ng government. Kasi ang distemper is highly fatal. Parvovirus. Ito yung lagi natin naririnig din sa Pilipinas na pag maulan, talamak ang malamig ang panahon, ang first sign ng parvovirus ayaw kumain tapos biglang nagtumae, ang tae niya ay may dugo. And then para-influenza virus, adenovirus, and of course, meron din po silang coronavirus. Mas naunang may nagkaroon ng coronavirus ang mga alagang aso at pusa na tawag dito, na coronavirus for dogs. And ang leptospirosis, kasama din sa bakuna ng 5-in-1, dapat updated din ito every 6 months or every year. And of course, yung kennel cough, 𝗛𝗲𝗀𝗶𝗴𝗃𝗃. Yan, deworming. Why the need of regular dewormer? Of course, ito yung mga types ng mga worms ng pets natin, maaso, pusa. Unfortunately, they are zoonotic. Ibig sabihin, ang mga worm na ito, roundworm, whipworm, hookworm, tapeworm, ay pwede nating makuha. Kapag ang aso ninyo or ang mga pusa ninyo at hindi regularly every 3 months na deworm, tapos bigla siyang nagpupo ng may worm, buong household dapat mag-deworm kasi most likely pati ang mga taong nag-aalaga ay meron din silang worm kasi ito ay napapasa. Heartworm. Ito naman, hindi ito napapasa sa human. Since ang Singapore ay may lamok, may 3 klase ng lamok, Aedes, Culex, at saka Anopheles. Ito po ay ang nagdadala ng larvae, yung maliit na worm. Kapag kumagat siya sa infected dog at naipasa at kumagat ulit siya sa isang healthy dog, pwede niyang maipasa ang heartworm. Fatal ang heartworm kapag napabayaan at hindi nagamot. Imagine yung puso punong-puno ng spaghetti. Yan. Parasite control. Madali lang naman po ang sabihin. Usually, most of you naman ay aware na with regarding sa bulate, sa pulgas, sa ticks, sa flea. Ayan. So dito, mga kuto ng mga alaga natin, kapag may nakita kayo, report nyo na lang kasi talaga namang mayroong program na binibigay ng mga veterinarians para sa mga pets with regarding sa parasite control. Hindi natin maiiwasan yan kasi we walk them. Kapag naglakad sila sa labas, pwede silang kapitan. So meron tayong mga products na available sa veterinarian na pwedeng ibigay monthly. In Singapore, rabies-free ba ang Singapore? Yes. Singapore has been a rabies-free since 1953. However, there are still reported cases of rabies in our neighboring countries. Ang rabies is a very contagious disease kapag ikaw ay nakagat ng isang rabid dog. Surrounding Singapore, kasama na po ang Pilipinas, tayo po ay may rabies. So, mahigpit po ang Singapore sa mga imports at saka exports with regarding sa mga alaga natin. Mga pumapasok na mga ibang pumapasok na mga alaga from outside the country, requirement po sa kanila ang bakuna. And of course, sa mga may expat na bossing, dapat regular din ang kanilang rabies vaccine kasi sa bansang pupuntahan nila, they might require rabies vaccine at saka rabies serology test. So, madami na tayong mga clients na short term, tawag dito, nagmamadali sila na kailangan kasi nung pupuntahan nilang bansa yung result na meron silang titer ng rabies at bakunado yung aso. It will take about a month bago lumabas yung result kung meron pa siyang antibodies with regarding rabies. So, rest assured, pag nakagat naman kayo dito sa Singapore, walang rabies pero masakit pa rin. So, it's better for them to be vaccinated. Not all of them can be vaccinated sa rabies kasi ang requirement lang is if kung lalabas siya ng bansa. So, not all veterinarians will give this vaccine kung hindi i-request. Leptospirosis, ito. So, ang Singapore din po ay may lepto. Ito ang mapa ng Singapore wherein na trace ang lepto na sakit. Last December, we have a case. We have isolated the case. We had reported to the NParks regarding sa case. So, ibig sabihin, meron pala talagang leptospirosis dito. Saan ba nakukuha yung lepto? Parang sa Pilipinas din, baha na may daga. Yan. So, ito ay zoonotic disease na pwedeng matransmit sa tao. Usually, tayo ay nilalagnat kapag tinamaan ng lepto. And fatal din ito kung hindi nagamot. Yan. According to the news last February 1, ang sakit ng leptospirosis ay dulot because of rain and rats to blame for more dogs in Singapore being infected with leptospirosis. So kung yung aso tinamaan ng lepto, most likely baka kumapit din sa atin. Yan. So most important thing, dapat malinis lagi ang dwelling ng aso at of course ng human and the cats also. So how to stay healthy? Lagi nating yung sinabi natin ni Doc Andy, we need to observe yung ating mga alaga. Aside from regular grooming, kung kayo ay may pusa o may aso, sabihin nyo na kay bossing na regular grooming na lang monthly. Sila na yung ipunta nyo na lang sa groomer para sila na yung gumawa ng grooming. And then of course, regular check-up sa vet. Kung may mga nakita kayong kakaiba, sabihin nyo na agad para maagapan. Because you are more familiar with your dogs than anyone else, you should watch it carefully for any sign of illness that other person or even us veterinarians may miss. So, unang-una, of course, yung mata. Kita niyo yung aso, nag-squint yung mata or may discharge, may lumalabas na dumi, kailangan niyo na ipa-check ito sa veterinarian. Kasi kapag pag nag-self-medicate ka, nilagyan mo ng kung ano-anong pampatak sa mata, baka mas lalong maging worse yung condition ng mata, baka pwede pang mabulag. Of course, sa ears, nabanggit na kanina ni Doc Andy, dapat alam niyo yung senses ninyo, yung itsura ng ear ng malinis at hindi malinis. So typically, we are allowed to clean, pero sabi ko nga, kasama na yan sa grooming, ipag-groom nyo na lang. Kasi dito sa Singapore, it's a tropical country, mainit, humid. Itong nakikita yung blue dito sa gilid, these are yeast. Kapag yan, tumama sa tenga ng alaga natin, mabaho po yan. So, yung sense of smell andun na. This is my picture, one of the patients. So pumunta sa clinic, madumi. So kumuha ako ng sample, stained, and then yan, positive siya ng malassezia. So kailangan niya nang mag-medicate. Regular cleaning, twice a day, dagdag trabaho. Nose, yan. So dahil ang aso ay mas powerful ang kanilang sense of smell kaysa sa atin, they usually use to rub their nose to some else. Yung sabi ni Doc Andy kanina, doon sa anal gland, tama iyon, na nag-aamuyan sila. So hindi maiwasan na madadamage ang kanilang nose. So it can cause bacterial infection. Kaya always observe kung dry yung ilong or wet yung ilong. It's a sign na something is going on with the pet. Hindi natin mapinpoint kung ano, kaya kailangan talagang ipakita sa vet clinic. Usually lahat naman ng may pet dito is may regular veterinarian na, hopefully. In addition, with regarding sa observation sa ating mga pet, hindi lang sa visually, kundi din sa demeanor, gaya sinabi ni Doc Andy kanina. Of course, dog have a strong sense of smell. Scientists reports that dog sense smell is 10,000 to 100 times more acute than human. Tayo din naman, kung sila, hindi na nila naaamoy yung kanilang bunganga, kung napansin natin or naamoy natin na medyo mabaho na talaga siya, mabaho yung bunganga ng aso, hindi ibig sabihin na dahil aso mabaho. No, there's smell signifies na meron nangyayaring infection or mabaho, or there are some things that happening into the mouth. So baka kailangan nilang linisan. Yan. Sa mouth, madaming problema sa mouth ng patient, sa mga alaga natin. Because not all of us are regularly doing toothbrush, hindi natin natutoothbrush yung mga pets natin. Most of the time, hindi natin nakikita yung bunganga na meron palang halitosis is bad breath, meron na siyang mouth ulcer or swelling, o minsan at talagang nagkaroon na siya ng gingivitis, dental problem. Ito, usually kapag ang pet is may sakit or nasasaktan, kahit gaanong kabait na aso or pusa, they can bite or they can scratch. Mas lalo na kung titignan mo yung mouth niya. And then of course, yung sabi ni Doc Andy kanina, the consistency, the consistency ng stool, ng poop, ng kulay, kailangan i-take note kasi one of the sign na sila ay healthy ay normal ang stool. Kung ito ay constipated ba or they are having diarrhea, there's something wrong with the pet. Kapag dehydrated ang aso, ang pusa, usually constipated yan. Kapag may diarrhea naman, ibig sabihin there's something wrong with their gastrointestinal tract. So most likely from basic problem up to cancer patient. Ang pinakamalalang mga pasyente ay mga cancer patient. Usually nakikita sa stool yung iba't ibang form ng shape ng poop. Common diseases, disorder, yan. Dahil nga dito sa Singapore ay tropical country, mas favorable ang mga bacteria, ang mga fungus, mga fungi, yeast na mag-thrive or mag-inoculate or dumami. Yan. So yung mga common sa skin problem, nakikita talaga hotspot. Yan. So wag na nating tawag dito, especially sa mga dogs na hindi gaanong napapaliguan. Very very high incident ang hotspot. Ito ay dahil sa bacteria harboring, tapos nagkaroon na ng infection sa balat. This one needs attention and this one needs antibiotic, and antibiotic only dispensed by veterinarian for pets. Kaya kailangan natin bumisita sa vet. Kung may nakita tayong kakaiba sa skin ng alaga natin, i-report na natin para bago lumala or bago lumaki. And of course, yung ating alaga kapag ayaw kumain. Ito ay tinatawag na signs and symptoms lamang. Hindi ito pwedeng ipagsawalang bahala kung ang alaga natin ay hindi na kumakain. Most likely may sakit siya or may nararamdaman siya. This needs a medical attention and kailangan ipatingin na ito sa veterinarian. From simple case to worst case, makikita talaga sa aso at pusa kung sila ay may sakit kung wala silang appetite na kumain. Yan, of course, nabanggit ko kanina with regarding sa scratching, skin problem. Yan, makate sa balat nila kung mayroong problema sa balat. So, hindi basta-basta tayo nagbibigay ng food kasi nga baka allergic sila sa mga food na binibigay natin. So, we must see, may food trial na tinatawag. We can offer, or kung matanda na yung alaga ninyo, most likely alam na ng owner kung ano yung mga dapat at hindi dapat ipakain. Yan, pills and chewable medications are usually relatively easy to administer to dog. Most dogs will readily eat the pill that is hidden in small treat. So nagpunta na kayo ng vet, nagbigay na ng mga gamot. You can ask them na kung hindi nyo kayang bigyan ng gamot orally yung pet, pwede nyong i-request na injectable na lang. So there are some medications na pwedeng inject and it will last you 14 days. Hindi na kailangan ng oral medication most of the time. Yan. So in healthy companion animals, kapag healthy ang pet, of course, healthy ang bulsa ng client. masaya ang owner kasi well taken care of ang ating pets. So, yun lang po. I always advise na kapag no pain, it's very good for our patient, for our pets. Maraming salamat po.
Thank you very much, Dr. Randy Galutan. Ayan, we learned a lot from your talk tonight, which is about the pet health overview, do's and don'ts. So don't forget to take care about the vaccine and to make sure that your pet is doing well at walang mga, like for example, sa eyes nila or even the skins. Kung may napapansin na kakaiba, dalhin sa veterinarian for grooming. And also, eto na, pinakaiintay. Okay, I would like to invite once again our guest speakers tonight, namely Dr. Randy Galutan and also Dr. Andy Galvan. Yan, palakpakan naman natin sila. If not, you can give them a reaction of heart or even yung palakpak na reaction. Ayan. So, first of all, for your question, you can type it in the chat box, or if you want to, you can click on the reaction, raise hand. So I will call your name and then you can tell them what is your question about. As for the answer, I leave it to Doc Randy and also to Doc Andy, who will be the one that will answer the question. Ayan. So Doc Randy and Doc Andy, ready na ba kayo?
Yes po.
Okay, so meron po mga questions, Doc, na narito na sa group chat natin. Ang kauna-unang question natin for tonight from Ma'am Cecil of Bayanihan Center. May mga special na pangangalaga ba na kailangan ang mga matatandang alagang hayop? Is there any special care that we need to give to our animals or pets who are already aging? Yan. So Doc Randy or Doc Galvan, take it away.
Okay, I
Yes,
will answer the question,
Doc
Doc
Andy na daw.
Yeah.
Okay, Doc.
Earlier, I mentioned about the life stages of the animals, right? For dogs and cats. And then usually for geriatric, we call it geriatric dogs. And then started from 7 years old. Okay, so kung meron po tayong mga asong may edad na, and then pupunta ka for regular check-up, usually ina-advise namin yung client or ng doctor, ng veterinarian, na mag-undergo ng general health profile. Okay, so general health profile is we will check all the organs, kidney, liver, okay, and then we'll also advise to do some CBC, complete blood count, okay, and then yeah, so mostly we do this, and then also electrolytes for older dogs. Yes, maybe you can add more, Doc Randy.
Yes, Doc. Thank you. So, gaya ng sabi ni Doc Andy, bakit natin gagawin yung mga blood test na yan? Kasi ang pasyente, ang pet na old patient or even young, they cannot talk. Hindi sila nakakapagsalita, hindi nila nasasabi kung ano yung masakit sa kanila. But like what Doc Andy said, may wellness check-up po tayo ng 7 years old and above for geriatric. Check yung CBC, check yung blood biochemistry to check. Parang sa tao din. I-check ko yung function ng kidney, liver, at saka yung sa mga matatanda, usually yung gait, yung walking nila, osteoarthritis, may mga makabagong mga gamot na tayo para dito. Most likely, yung diet nila, iba din. Maiiba na kasi yung resting requirement, energy requirement nila ay kaiba na sa mga puppies at saka sa mga mas younger. Yan po.
Yes, thank you very much, Doc Randy and Doc Andy. Para palang tao din, they have to undergo a health screening, ano?
Correct.
So we will know what is going wrong with them or if they are still healthy. Now, let's go to the next question. This question came from Miss Anne Espira. Ang sabi niya, good eve po, question po, what about if a dog having anxiety? What am I going to do? Ayan, Doc Randy, Doc Andy?
Yeah, anxiety po. Okay, so very common din sa aso yung mental stress. Okay? So, dapat alamin natin kung ano ba yung nagko-cause first and foremost no anxiety ng animal. Okay? So in veterinary settings, one of the most common is when they go to the vet. Okay? Same thing yung mga bata. Okay? Kapag hindi mo sila tinrain na pumunta sa clinic, usually na-stress sila. Okay? Kahit ikaw mismo hindi ka sanay pumunta sa dentist. Pag narinig mo ni dentist, ma-stress ka na, okay? So ang ginagawa namin sa vet clinic, pag meron ng history ng ganyan, nagbibigay kami ng na pampakalma. Okay, mga tabletas na binibigay para pagdating ng aso, medyo calm na yung aso. Ayun. So yeah, Doc Randy, that's
Yes, Doc.
just
Regarding anxiety, yeah, madaming kagaya ng sabi ni Doc, fear na paglabas ng bahay, fear na pumunta sa vet, separation anxiety. Madami pong mga cases na ganyan. We have short-term medication and long-term medication for anxiety po.
Okay, thank you very much, Doc Randy and Doc Andy. So pag may mga bago palang experience for the dog, they tend to have anxiety. Yung pala yun. So we have to train them going to the veterinarian so they won't have any anxiety at all. Thank you for your answer, Doc Randy and Doc Andy. Now another question from Ma'am Cecil of Bayanihan. Oh, she told me that it is from Sure Flags. Ang sabi niya, in your experience, what are the easy dog breeds in terms of health risk and temperament that are great for first-time pet parents or a family with children? Ano daw madaling alagaan para sa mga first-time fur mom or fur dads at isang family na may mga bata? Ayan, Doc Andy, Doc Randy.
I'll start again, Doc Randy. Okay, I'll be biased on this. Okay, because I have two kids. I have AJ and Paeng, my two sons, and they love Maltese. Okay, so there's pros and cons. Okay, because we are living in HDB. Okay, you have to consider where are you living also. Okay, number one, Dr. Randy mentioned about the regulations of the ABS regarding what kind of pet are you going to raise if you are living in HDB or if you are in landed properties. Then you are allowed to, have large breeds. Okay. So yeah, very important because nakatira ka sa HDB tapos gusto mo ng golden retriever, so it will compromise the health of your animals also. Yeah. So yeah, and then yung Maltese gusto ko kasi siya medyo gentle siya sa kids. Okay? But it's a little bit high cost maintenance with regards to grooming. Okay? And then yeah, because they are white and then they are furry, so make sure you always vacuum your house. Okay, thank you.
With regarding sa na good temperament na pet, most of the time, ang sabi nila is golden retriever. They're very docile, mas mababait sa mga kids. But then, that depends on how you raise your dog. Kung talagang mabait yung aso, mabait yan. Kung hindi mo sinasaktan, hindi yan mangangagat. Yun po.
I see. So, you reap what you sow what you reap, ano? Kung anong binigay mong love, the pet will return it to you. Kaya pala,
Exactly.
doon magbabase yung bait ng pet mo.
Yeah.
And then, dahil we have to check also yung ating tinitirhan since we are staying mostly in the HDB flat, there is a certain dog na nababagay doon or pag-landed house. Yan. Thank you, Doc Randy and Doc Andy. We have another question from Esther Trinidad. Ang sabi nila, hi, Doc. What are the common causes of choking in our pets? Is there a home remedy for it or it's a call for emergency? Ayan. Doc Randy, Doc Andy?
Okay, Doc Randy. Okay, I mentioned earlier about the foreign bodies, okay? So, medyo tricky yung question ni Doc Esther kasi sinabi mo choking, dapat alamin mo kung ano yung nagkakos ng choking niya. Okay, another issue is, okay, let's say in the cat, okay? Because they like shiny objects, okay? In clinics, it's very common that makakakita ka ng pusa after x-ray, makikita mo may sinulid, may kasamang needle after the x-ray. So common yan, okay? So this is one of the common thing, foreign bodies that can cause this issue. And then obviously, if you see some choking thing, it's an emergency. So you have to rush it to the vet. Okay, so anong gagawin mo kapag may case ng ganito? Number one, same in human, you have to do ABC. Okay, you need to check the airways. Nakakahinga pa ba yung aso mo? Okay, nagbe-breathe pa ba yung aso mo? And then your circulations. Kasama na dyan yung pag-check ng gums, kung mamumutla ba, something like that. So you need to know your ABCs in terms of emergency. Thank you, Randy.
Yan, to adapt sa sagot ni Doc Andy kay Doc Esther na vet din, what are the common cause of choking? So, common cause of choking, sabi ni Doc Andy, is foreign bodies, of course. And kapag yung food, iba yung way na pinuntahan, isang cause of choking din. And it's ito lang masasabi ko sa mga pet owners, sa mga may pet dyan, alamin ninyo yung surrounding ng HDB ninyo or yung place ninyo, yung pinakamalapit na vet. In case of emergency, pwede normal working hours open sila, even lunchtime. Or usually some clinics, alamin niyo yung opening hours nila. Usually most of the blocks yung malapit lang dito sa area nyo, doon nyo ipunta yung pet ninyo. A sign of choking can be simple or can be serious. Kaya kailangan siyang makita x-rays kung ano yung nakabara doon. Diyan, in case of emergency, home remedies, we don't recommend home remedies kasi kapag ginalaw mo yung pet tapos may nangyari mas masama, baka mapakasalanan ka pa.
Ayun. So thank you, Doc Randy, Doc Andy. So shiny objects can be one of the causes of choking. It is not recommended for a home remedy kasi baka lalong mapasama yung ating pets. The best thing is to bring them to the veterinary, which is nearest to your location. Ayan. So I can see someone's raising her hand. Yeah, I would like to call on Afi. Yes, hi Afi, good evening. Anong tanong mo para kay Doc Randy and Doc Andy?
Hello, Joanne. Thank you. Hello, Doc Randy and Doc Andy. I remember last time my grandmother had lots of cats as pets. So tanong ko lang, kasi medyo problema namin before yung saan sila nagtatay. So can we train them kung saan dapat sila magtae?
Okay, Doc Randy, Doc Andy?
Doc Randy?
Okay. Okay, ma'am. It's their nature sa mga pusa that they dig their poop sa cat sand. So, ayun. And there are some dog trainers and cat trainers na train nila yung pusa na mag-toilet sa talagang toilet bowl. Yan. They can be trained, and like I said, sa pusa nature nilang pumunta doon sa cat sand. Sa dog naman dapat when puppies pa lang, tinetrain na natin silang iwalk sa grass para doon lang sila tumae at umihi.
May I add something about that? Miss Afi, how many cats do you have? Do you still have cats at the moment?
No, I don't have at the moment, sir. Pero dati talaga yung lola ko, sobrang dami.
Ay, ganun.
Kaming cats before.
Yeah, kaya ako po naitanong kung ilan po yung pusa nyo dahil related to your question, which is training, okay? And then how many cat litters do you need to put in the house? Okay, usually the formula is number of cats plus 1. So if you have 2 cats, dapat meron kang 3 liter sa loob ng bahay. Okay? And then addition to that, since yung mga pusa hindi ganong umiinom, and one of the common cause of death for cats is kidney disease, okay, because lack of drinking water. So I also advise if you have water bowl, so you need to position it strategically in the house where your cats always go around. Okay, so in addition to your litter thing, because it's related. Okay, and then I mentioned earlier in my slides about the FUS, feline neurologic syndrome, or in cats it's very it's very common to have a blocked cat that cause some very serious and emergency case. Okay, so hindi sila makakaihi kasi pinipigil nila hanggang sa mag-build up na yung stones or crystals and then other things or urethral plug, and then yeah, it's very common. So it's an emergency in the clinic. Yeah, thank you.
Thank you, Doc Andy and Doc Randy. By the way, I just want to invite you guys for I'm Afi from Philcom at 𝗥𝗲𝘀𝗽𝗍𝗃 Toastmasters Club. If you are not familiar with Toastmasters International, it is a nonprofit education program that helps you build your confidence and improve your leadership and public speaking skills. And this coming March 23rd from 5 to 8 p.m. At somewhere in Novena, we will have our TM 101. And in Philcom, we can help you improve your public speaking skills, your leadership skills, and at the same time, we can also be your family as we treat each other as family. So hope to see you guys. I will send the details to Joanne. Thank you so much.
Thank you, Afi.
Okay.
Back to our topic. Yes, Doc Randy, Doc Andy.
Free daw po ba yun, Doc Randy?
Okay. So thank you very much. So remember, if you have number of cats plus 1, yun dapat yung kanilang liter na kung saan sila magpupupo. Ayan. So ngayon, let's go back to our question and answers. From Chris Baugad, sabi nila, Doc, any home remedy para at least malesen yung halitosis ng senior dog ko? Ayan, may bad breath din pala ang mga dogs. Sige, Doc, take it away.
You wanna take this, Doc Randy?
Okay, Doc. Sabi ko kanina, from puppy, kailangan na nilang magkaroon ng general check-up. Hindi lang yung kapag may sakit. They need to go to the vet para sa kanilang dental check. Yung halitosis dahil dyan sa may nabubulok ng ngipin. So, yearly yan. Kapag pumupunta ka sa veterinarian, ipo-point out nila na kailangan na niya ng dental cleaning, dental prophylaxis, kung kailangan matanggal ng ngipin. And of course, they will advise na after meal, kailangan mag-toothbrush.
Wow.
Okay, yeah. If I may add, okay,
Okay.
so how old na po yung dog niya? Kasi kung na-mention na po na geriatric and then there's some halitosis already, and then hindi na po uubra dyan yung toothbrushing. Okay,
Oh.
so ang dapat dyan dalhin sa doktor, magkaroon ng dental, proper scaling, and then minsan po kasi kapag napansin mo pag may mga tartar build up na dyan, and then pag ginawa natin yung dental, mapapansin mo meron na ring erosion dun sa dental pulp, so sa dental enamel.
I
So
see.
usually very firm pa siya kung titignan mo sa labas, pero after mo matanggal yung tartar niyan, candidate na pala siya for extractions. So that's why daily check-up, routine check-up for dental is very important. Kaya nasabi ko, mas mahal magpa-dental, mag-extract ng tooth, kaysa yearly dadali mo siya for dental check. So, thank you.
Alright, thank you. So, tandaan ang ating mga pets, kailangan din ng toothbrush or dapat dalhin talaga regularly sa ating veterinarian para ma-check kung may tartar na ba or may corrosion ang kanilang mga ngipin. Ayan, so mga doc, may question pa tayo dito. Para humaba ang buhay ng aso, ilang meals ang kailangan per day? What time usually ang pagkain? Ayan. Doc, take it away.
Nutritionist, Doc Randy.
Okay. So, gaya po ng tao, kailangan natin ng proper diet. At higit sa lahat, yung tamang portion ng meal, nakabase yan sa body weight ng aso. Kung yung kailangan niya ng daily energy requirement, daily calorie requirement, at of course, yung water intake. Hindi yan papalya kung for example, sa Chihuahua, hindi mo yan bibigyan ng 2 lata. Isang 1/4 lang. So it depends on the size of the patient and the age, kung ano yung mga protein na needed niya. And of course, yung water intake, napaka-importante, hindi lang water, clean, fresh water always.
Ayun. Thank you very much po. Ayan, tandaan natin, kailangan din ng clean water para sa ating mga pets. Ayan. May another question pa dito, Doc. Sabi nila, paano po na-acquire ng dog ang pagkakaroon ng cherry eye? And what are the possible effects pag lumalaki po ang cherry eye at hindi siya naoperahan? Ayan, Doc.
Okay, cherry eye is a protruding ng nictitating membrane. So normal sa atin, even sa atin, meron tayong nictitating membrane. Yung cherry eye na yon, tinawag lang cherry eye kasi mukha siyang cherry pag lumaki. For me, as a surgeon, it is advisable to remove. Kasi pag lumaki yan, tapos naging abala, nakalmot niya, nagkaroon ng infection, mas malala, baka buong mata nang tanggalin.
Oh. Alright. So even the eye, we have to bring our pets for check-up kasi yung cherry eye pag lumala, baka matanggal pa ang buong mata ng ating mga alagang hayop. Ayan. Another question from Stephanie. Is it safe to share your sleeping space with your pet? Ayan, mga doc.
Oo naman po. So, okay, kaya pet-loving people tayo. So, pwede naman nating i-share. Pero binanggit nga ni Doc Randy kanina, make sure that we are aware of the health, not only in our own health, but the health of our pet. Because we can also share diseases, o yung tinatawag na zoonotic diseases. Even worms we can share. Okay? So, yeah. So, just make sure proper hygiene so we can share. Thank you.
Ayun. So, if our pets have a proper hygiene, regular checkup, and it's also safe to share our bed with our pet. Ayun ba yun? Kasi otherwise, they can also share the whatever pests or parasites they have with us. Ayan, last question. Meron po tayo from Mary. Sabi, hello po. Tanong ko lang po about the black stuff under the cat chin. What's the cause and how to prevent it? Yan, mga doc.
Tinatawag po yan na feline acne. Yan.
Feline acne.
Linisin lang po. Madumi lang talaga siya.
Oh, I see. Okay.
But
Doc Andy?
sometimes you can also consider if your cat is having fleas, because sometimes nag-build up yan ng mga, because fleas is sometimes very difficult to recognize, because they jump very high, they are very fast. Okay, sometimes it's very hard to see them on your cat's fur. Okay, so what I'm saying is you need to make sure that your cat also receives preventive treatment. Okay, we have the spot on that we are talking about. Okay, that prevents your cats having fleas. Okay, so maybe one of the signs why your cat is having these things. Okay, but Doc Randy is correct. Sometimes it can just be because the way how they eat, their hygiene. Okay, but for me, I will take it as a conservatively, like, I think I need to check. Okay, is my cat have this spot on regularly? Okay, because it doesn't really. It will also help to prevent heartworm. Okay, and other worms and external parasites. Thank you.
Ayan. So, it could be feline acne or it could be fleas na hindi pleasing sa ating mga pets. Kaya dapat regular check-up talaga ang dapat natin gawin sa mga pets natin for total care for our pets. Ayan po, may sinabi si Stephanie, sabi nila totoo, 1 meal a day lang ang dapat ang mga pets. Kasi ang sabi sa Animal World, kumakain lang talaga sila na isang beses sa isang araw kasi nag-hunt sila. Yan. Ano naman yon? Additional info from Animal World. Ayan, sa Doc Randy.
Tama na. So, with regarding sa na-present ko kanina, they shared same ancestry na pinsan nila ang wolf, na they are hunters. Yes, that's correct. But now they are domesticated. Hindi na sila nagha-hunt. So why would you feed them once a day? We domesticated them, we give them shelter, we give them food, at home. Hindi na sila nagha-hunt. I don't categorically say na mali yung once a day. Kung yun na talaga ang upbringing nila since puppy siya na once a day lang kumain, it's okay. But then, if health likewise, kung tayo kumakain 3 times a day tapos once a day lang yung pet, there are certain point in time, in 24 hours, na wala nang laman yung tiyan niya, empty na because once a day lang siyang kumain, it can cause ulcerations, it can cause some other problems. Magbebeg yan ng food. So, for example, may bisita, nagbeg ng food, binigyan ng buto. It's a problem.
Yeah. So again, just to reiterate, make sure that your dog is, taking the daily requirements. Okay. Most of the dogs in Singapore, so we are feeding them with dog food. Okay. Check all the labels, and then there's a recommendation there. Kung ilan lang o ilan lang dapat mong ibigay. Halimbawa, kailangan 10 grams lang, like for example, okay, let's say 10 grams lang for the specific weight of the dog. So if you want to give all the 10 grams, okay, just feed it 10 grams one time, or you can divide it into 2 meals. Sometimes you can divide it into 3 meals. So yeah, it depends. It depends on the daily requirements of your dog. Thank you.
Okay, thank you. We have another question from Anastira. I think this is the last question for tonight. Is it possible for dogs not to be friendly with other dogs? Because every time we go down to the field or at the park, whenever my dog see other dogs, he will growl at them. Yan, hindi friendly ang dog. Doc.
Doc Andy.
Yeah, okay. So in terms of that, I would say, it's a behavioral thing. Okay, it's common for them to be like reacting that way. Okay, but it doesn't mean that there's something wrong with your dog. Okay, so yeah, I think for me, you have to make sure that your dog is properly taken care of in terms of behavior, like regularly walk out, and then because sometimes yung ibang aso kasi confine lang sa HDB o nandun lang sa loob ng bahay. Siyempre, pag may nakita siyang iba, and then magre-react siya. Okay? So, yung iba naman, kaya banggit ko kanina, medyo friendly, nag-check sila, yung nag-ni-snip nila yung anal gland nila, and then chine-check nila. It's way of their communications. Kung sa tao, merong mga tinatawag na introvert, may extrovert. So, meron din sa hayop. But again, you need to make sure that you're very specific on what kind of behavior your animal is showing. If it is like being aggressive to the point that causing injuries, I think, and you have to check and bring to the groomers. Okay. And then there's some animals na very aggressive, not only in other pets, and also in other human. Okay. It's a proper way of training lang. Okay. So you need to send them for proper training. Thank you.
To add
yes, Doc.
to add up sa sinabi ni Doc Andy, yung behavior nila very territorial at ang mga alaga din natin ay seloso din.
I see. May mga ganun pala.
Yeah.
Siloso, not friendly.
Okay,
Agree.
Yeah, that's right, Miss Joanne. Mai-share ko lang kasi halimbawa, meron kaming kliyente na yung small dog. Okay? Hindi mo akalain na very aggressive. Pag dumaan ka doon, hawak ng may-ari yung aso, hindi talagang ibabite ka niya. Okay? So, pero pag wala na yung may-ari, pwede mo na siyang hawakan. Kahit anong gawin mo, ear cleaning and things like that, then you can do to the dog. Yeah, so it means that this dog is just very protective about their owner. So that's one way. Okay, it's very common. Yeah.
Wow.
So sometimes we just ask the owner, oh, maybe you can just wait outside. Okay, and then we collect blood. Then we can do other things. But kapag nandun na may-ari, napaka-aggressive niya, nangangagat na siya.
Protective.
Thank you.
Yun.
Yeah.
Yes, thank you, Dr. Randy Galutan and Dr. Andy Galvan. Bigyan naman natin sila ng isang masigabong palakpakan.
Thank you.
A very good round of applause. Ayan, congratulations. Thank you very much for your workshop or webinar for tonight. We learned a lot from your workshop, Doc Andy and Doc Randy. By the way, sila po ay members ng Veterinary SG. And ito po this webinar is brought to you by Philippine Bayanihan Society Singapore or PBSS. And it is founded since 2001 and it is the 2021 Philippine Presidential Awardee, Kaanib ng Bayan. Ang ating pong Bayanihan Center ay matatagpuan sa 43 Pasir Panjang Road. At ang kanila naman pong email address to contact them is bayanihancenter@singnet.com.sg or you may call them at 6474-3700. Ito po ang kauna-unahan nating Bayanihan Talks ng Webinar Series 2024. At yan ay brought to you by Veterinary SG by Doc Randy and Doc Andy. Now, to contact furthermore with Bayanihan, if you have any query with regards to training, like for example, hair and makeup, baking, cooking, or even healthcare or elderly care, meron po ang Bayanihan yan. So, you may contact them through Facebook page at facebook.com Bayanihan Society SG, or you may follow them on Instagram at Bayanihan Society SG, or you may support them at https://www.giving.sg/PBSS. You may subscribe to their YouTube channel as well at Philippine Bayanihan Society Singapore. For sponsorship or opportunities are available also, please email them at bayanihancenter@singnet.com.sg. Yan po. Ang Bayanihan po, it is actually a connection between the Philippine government and also with the Singapore government to bring seminars, webinars, and trainings for Filipinos to promote cultural events and for social events as well. For donations, you may scan the QR code. Please, through Pay Now. And the next Bayanihan talk or webinar series will be on March 28, Thursday, 2024. So next month again. Ang topic po natin ay self-mastery or learning personal leadership. Ayan. Ang guest speaker natin ay si Miss Melrose Angeles. Siya ay Director ng Human Capital and Development Pan-Pacific Service Suites, Singapore. Ayan po. So for tonight, we would like to thank everyone who gave their time to attend our webinar, and we are grateful to our very excellent speakers for tonight, si Doc Randy and Doc Andy. Once again, thank you very much. And hopefully, everyone learned a lot from this webinar. So thank you for joining us today. I hope you had a fruitful evening with us and hope to see you on our next Bayanihan Talk series next month on March 28. Ayan. Yes, Steffi, do you want to add in some announcement? Ayan po. So, bago po tayo matapos, baka pwede po tayo mag-on ang ating video for a photo shot para sa ating webinar na ito. Yan, paki-on naman po ang ating mga cameras. Thank you for joining. We have attendees from Apo AAS, from Philcom, and all other organizations. I think marami dito from Veterinary SG, no? Ayan. Thank you very much. Ayan po. So, Yan, let's take a photo. Ayan. Okay, let's have our smile. Okay, 1, 2, 3. Okay. Isa pa po, dahil medyo marami ang ating attendees ngayon. Ayan. So, punta naman tayo sa second shot natin. Saglit lang po. Ayan. So, punta tayo sa page 2 of 2. Again, let's give our sweetest smile for our pets and for our veterinarians. Okay, let's smile. 1, 2, 3. Ayan. Thank you very much for tonight. And thank you for joining. So, Miss Steffi, Miss Cecil, see you again next month. Bye.
Thank you.